I think one of the biggest shifts that's happening today is incorporating blockchain in across healthcare providers. So I think in the US and parts of Asia, there are healthcare startups that are coming up and saying that we will aggregate a lot of your healthcare data, but via a blockchain, so that of course it's decentralized and not one person has access to it.
So one other aspect of this is also about data security and privacy, right? I mean, we also discussed this briefly in our last podcast discussion of how privacy is very important in healthcare, and personally identifiable information should not be out and things like that. So how do we, what are some of the compliances that are there to put a check and balance on these, right? And how many are there? Like, for example, US being one of the largest, biggest markets, which is very highly sensitive on this, and maybe other markets like UK and Singapore, and now India also is talking about multiple different policies on data security. It is as important today as banking sector, right? Today, when we talk about healthcare and information about a personal individuals' health records, these are very sensitive information. So how do we put some checks and balances in terms of privacy and security?
So I think one of the biggest shifts that's happening today is incorporating blockchain in across healthcare providers. So I think in the US and parts of Asia, there are healthcare startups that are coming up and saying that we will aggregate a lot of your healthcare data, but via a blockchain, so that of course it's decentralized and not one person has access to it. And I think it's a big enough market to actually use healthcare use blockchain as a technology. I mean, of course there has to be a market size for blockchain to be viable. So I think moving forward, a lot more of our healthcare providers are going to be adopting blockchain, and that way I think the security aspect should be handled quite well there. Yeah. So blockchain is one of the biggest changes that's coming. That's already there in some countries, but I think it's not a regulation that it has to be a distributed ledger. But because end of the day, it becomes more important because there are multiple sources also, right, of data, right? If one person is like for example the hospitals, of course they have the budget, they will be super secure, all of that. But if it's a medical testing center, not a big chain with something more local, something in a smaller city, right? I mean, they have the expertise to do the medical tests, right? But they may not have the size to actually invest in something like data security and, maybe go through a proper VIPT of their systems, or have access to distributed systems across multiple data centers, right? So all of that may not be there, right? But if they subscribe to some sort of a blockchain system, right, that's not managed by anyone, but it's just distributed, so that way they don't have to worry about security. Nobody has to worry about security, essentially, right? So it would help the bigger players and the smaller players, and it would democratize access to the right data, I feel. Yeah.
The government and the policymakers are key here, because they can push a lot.
Yes.
And in India, I think we have like the Aadhaar as the Aadhaar number, which is the social security number in India, and we now it's coming something like Aabha number, which is very similar. Yes. For the health purpose, right? So now we are coming from the I think it's called Ayushman Bharat Digital Mission, ABDM, and you get a number, Ayushman Bharat number, or whatever Aadhaar based number that you have. Okay, let me just correct myself. It is for electronic medical records in India. So we have something like
for sharing
of, and then sharing with the
sharing
consent
of medical data.
Yeah, you can tell how long you want to give this data to. So you own your data. Then you can decide when to give this data to someone for whatever reasons, and how long you want to give the data. Right?
Yeah. So this incorporates the point of consent also.
Yes, that is
right. So there's always consent.
Stack, how India Stack is there for all these stuff.
Correct.
This is something that is coming, and it's a great vision, and that's a great initiative by the government, because now if you then everything should be like Aabha, certified, or or Aishman,
Correct,
the
correct.
national health integration, everyone. And then you don't have, for example, a lot of time what happens is, if you have gone to I'm speaking from an India perspective. If you're going to a big chain of hospital, and then you have gone to a certain doctor, and all the tests are done there. Once everything is done, now all the data, they may give you a copy, but it remains with the hospital. They may give you a copy, but
Yeah.
they have data. They
Yeah.
own this data, and now we know that this data is a new oil, and they can use this for many other things, maybe
Yeah.
for good, like to optimize their own operations and all that. But it could be also sold in the market where they can get good price,
Correct.
right, about this patient health
Correct, correct,
data.
correct. Yes, definitely.
But the challenge for the patient is that this same patient now wants to take a second opinion, goes to another hospital. They may have these copies, but they will ensure that everything, all the tests have to be repeated, or things
Done
like
again,
that.
yes.
Because
Yeah, so
going
I
with
mean, there's
fear,
a lot
right?
of.
I mean, even if something like a
Yes.
legal thing happens, they would say, you know what, when we did the test, this was the thing. There's no standard way of putting it. They can always tell this is a machine error or things like that. So if we can have it in a single place, and then we said, okay, we did this, there should be some fear that, okay, it is not owned by us, but it is owned by
Correct.
an individual.
Plus, I mean, think of the amount of extra time and effort and cost also
yeah.
spent, right? Doing the test again, waiting, right? Some of these things, like the earlier you detect it, it makes a lot of difference. Especially like recently, cancer research has become a lot better, right? There are a lot lesser people dying of cancer, percentage-wise at
Yeah.
least, today than 20 years ago or 30 years ago, right? But I mean, imagine if you're someone who's going to get a checkup for a certain type of disease or terminal illness, right? And you're not getting the right sort of care at one hospital, then you go to the second, and then you go to the third, and there are many people who do this, right? And at every single institution, it's like the same process all over again, right? And you're already in some sort of a fear and anxiety, like you don't know what's happening. Every extra visit you take, that just doubles the fear and anxiety, right? So on a wellness side also, I mean, this would help patients be a lot more relieved, where everything is seamless, and getting a second opinion is a lot easier than it's not a very high effort thing. And in fact, if tests are done, what can also be done is, if you need a second opinion, you may not even have to go to the hospital, right? If there are tests done already, and
You can just share a copy of these tests to some doctor sitting in US,
exactly,
and or
exactly,
maybe any part of the country,
world, right?
I mean, and then
Yeah. So in those kind of cases where it's like there are even doctors, they themselves ask other doctors for second opinions,
It
right?
can be like, I'm unsure, what do you think about this? There can be a committee that can decide on this,
Yeah.
and then take
Correct.
a call.
Yeah, and the whole concept of pathologists who have to analyze blood work, analyze medical imaging information, put all of that together and advise the doctor again, that could be done remote, right? So it could be, so places where the density of hospitals are lesser, right? Instead of, okay, we don't have a pathologist in today, they will come tomorrow and stuff like that, right? You could use some other time zone, some other anything, right? If it's really urgent, it gives more opinions on the same data, I feel. And of course, in the healthcare space, the more opinions do matter.